Good evening. I am Michelle David, Chair of the Board of Directors of Health Equity International St. Boniface Hospital. I have a statement to make before we begin the program, as I feel compelled on behalf of the organization to address the inhumane treatment of Haitian migrants at the US border. All of us as Health Equity International St. Boniface Hospital are horrified by the continued deportation of Haitian migrants who are seeking asylum and refuge in the United States. We stand in solidarity with the men, women, and children who have made the very difficult journey from Haiti in search of peace and a better life. As you all know, our team is on the front line of the earthquake and the humanitarian response in Haiti. We have seen firsthand the absolute devastation that this disaster has wrought in the community we serve, and we know how tenuous their grasp on survival can be. It is unimaginable that people, human beings, are forcibly returned to circumstances such as these. There is no justification for the brutality they are enduring. Health Equity International St. Boniface Hospital believes that every person deserves to be treated with dignity and respect. That is what we stand for, and this is what we do every day. At the hospital, in community near and far, we honor our shared humanity, that of our patients, staff, and partners. It is important to us that we raise our voices, say this out loud, especially because so many people are silenced. And now, I hope you will raise your own voices with pride and joy as we truly begin this evening gala. We have so much to celebrate at Health Equity International St. Boniface Hospital, and we are so glad you have joined us.
Good evening, and welcome to Health Equity International St. Boniface Hospital's 2021 Virtual Gala. My name is Beth Floor, and I sure do wish we were all together in person. I am an HEI St. Boniface Board Member, and along with my dear friend, Barry Landry, co-chair of this year's event.
And I am Barry Landry, Board Member Emerita, and very proud co-chair of this event. We are delighted you have joined us tonight to recognize all that the Health Equity St. Boniface team has accomplished and to honor Father John Unni, pastor of St. Cecilia's Parish. Welcome and thank you for being here.
This year, our team of over 500 took the terms hardworking and tenacious to new heights. They led the COVID-19 response for all of southern Haiti, a population of over 2 million people. It was, as it always is, all hands on deck. But of course, as we all know, COVID was only part of the story at St. Boniface Hospital this year.
Our staff saw over 500 patients a day, expertly performing complex surgeries, tenderly caring for the fragile newborn, and advocating fiercely for the rights of their patients.
And they did this while navigating ongoing civil unrest and global supply shortages.
Then, as we all know, on August 14th, an earthquake struck southern Haiti, and our team immediately set to work saving lives. As the only hospital in the region able to treat traumatic injuries, our first priority was to expand our surgical program to include orthopedics.
St. Boniface is also the only hospital in Haiti with a comprehensive spinal cord injury and rehabilitation center. Now we're providing the vital long-term follow-up care and physical therapy for these patients. Our team has already cared for thousands of patients impacted by the earthquake, and we will continue to do so until they are well.
Our earthquake relief efforts, like everything we do at Health Equity St. Boniface, are entirely Haitian-led.
This incredible work has been made possible by all of you. Some of you here tonight have been friends of the organization for years, ensuring that St. Boniface Hospital remains a beacon of hope for the people of Haiti.
And to those of you who are new to Health Equity St. Boniface, a very big welcome. Your support means that we can continue to treat every patient who needs us, regardless of their ability to pay.
Nobody embodies the spirit of this work more than our dear friend, Father John Unni, tonight's honoree. You will hear from Father John later this evening.
Now, before we move on to the rest of the evening's program, we will say on a personal note that we are honored to count ourselves as donors to Health Equity St. Boniface tonight. We have both supported this team of courageous, dedicated staff for many years, and we remain in awe of them.
That is why tonight we, along with our dear friend, Father John Unni, are renewing our commitment to Health Equity International and the people of Haiti. We hope that you will too.
Now I'm pleased to introduce you to our host for the evening, Connor Shapiro, our President and CEO, and Dr. Inobert Pierre, the Director General at St. Boniface Hospital.
Thank you, Beth and Barry, and welcome everybody to our 2021 Virtual Gala. I'm Connor Shapiro, President and CEO of Health Equity International, St. Boniface Hospital.
And I am Dr. Inobert Pierre, Director General of Health Equity, St. Boniface.
We're so glad you're with us tonight to celebrate health, equity, and partnership at Health Equity St. Boniface Hospital. I want to echo Barry's words and welcome those of you who are new to the Health Equity St. Boniface family.
And to our old friends, thank you again for your commitment and support. Everything that you see tonight happened thanks to you.
Tonight, we are so proud to show you all of the work that you made possible. You'll hear from some of the countless patients whose lives you helped save and the courageous staff who time and again rose to every challenge.
We will hear from two important partners, Father John Unni, tonight's honoree, and longtime HEI St. Boniface friend and board member.
And Dr. George Dyer, a relatively new friend who took time off from his position as head of orthopedics at Brigham and Women's Hospital here in Boston to help us get our ortho program off the ground. We have a great lineup of speakers and videos for you tonight, and at the end of the evening, we're excited to do our first ever virtual Fund a Need.
Before we dive in, I want to acknowledge that 2021 has been a difficult year for many of you. No matter where you live, the COVID-19 pandemic continued to impact all of our lives in large and small ways. But despite the uncertainty and loss you faced, you stood with our staff and patients in Haiti during this extraordinarily difficult year.
The video you're about to see highlights only a few of the hundreds of staff and patients we see every day. Each has their own story, and you have touched each and every one of their lives.
Le tremblement de terre 14 août là t'es passé à moi t'es entré sous la cour l'hôpital là.
Actually, I was on my way to HEI, and I got a call, and then I had to return to the hospital and bring a patient to the emergency.
It was so quick. I was in the house, and I just feel that the earth is shaking.
I was part of the team, the first team when we have to evacuate patient, and for this we have to decide which patient to evacuate.
Pendant que le était passé, nous avons tremblé. Nous allé me courir, on reçoit avec ma tête la guimate. Nous avons baguette à me courir, on la guimate à minsou, on revient par souplia, il casse. Nous pendant nous âgé au bout de 5 jours, bah devant pendant la prière nous avons dit soir. Il faut que nous temps peuple là. Mte chita bon pi bois. Mali mpanga na mari nan bi da bois. Mari wa mouyi kou da pou kal mpige nan bouche mwen bois de l'eau. Lève mwen ti chèche, tap chèche. Beaucoup à l'hôpital. Pendant mon hélicoptère, mettez mon terrain, on a ambulance pour prendre côté dans l'hôpital là. Et moi l'hôpital là, il a fait radiographie, il a puis à casser.
So he spent basically 4 days without being, attended by anyone, and he came here after days in other hospitals where he couldn't get surgery, and the same day that he got here, his thigh was fixed.
When that happened, we were also expecting a tropical storm. So at this point, we were preparing for that. So we had already had a plan, but we had to also make sure that everyone, all the patients were safe here, and the structure, if it was safe to do that. So the assessment was really done rapidly.
Pour le moment, et majorité malade que nous avons recevoir dans le service chirurgie et que nous avons soin, c'est malade en plus là qui étaient victimes du tremblement de terre là. Seul ça qui fait différence pour le moment, sauf que cas chirurgie n'a recevoir c'est surtout cas trauma et que nous recevoir en pile malade orthopédie que généralement nous pas de recevoir l'hôpital là.
We need more hospital with surgical capacity, and we need more physicians also with surgical orthopedic specialty to help people mostly in remote areas.
Alexa Flores, 29 ans. Je dormir, pendant que je dormir, quand je travaille le marché, quand je me relève, pendant que je suis pendant ma couille de la passe dans le bloc là, je suis tombé sur de là. Quand je suis tombé, quand il a tombé sur moi.
Moi, ça a venu, ça a vraiment maison de l'eau dans le qui vraiment m'a consolé. Et puis, les venus vers la paix encore, pour que je me dise traiter là encore, ça a venu un peu plus mal. Au niveau de santé, ça c'est une catastrophe naturelle. L'autre regarder pour t'apprendre, pour sortir bosser à la voile, pour un petit soin qui, un petit gens, c'est juste un développement. Juste un pour ça changer. C'est un bon bagage qui t'a passé encore, même que ce n'est pas Alexa qui subit, même que si nous sommes venus à la fraternité, nous sommes capables de faire bon gens soins.
Mobile là, il est important en pile. Parce que quand c'est des zones qui sont éloignées en pile, c'est par rapport avec clinique mobile là qui peut joindre les gens. Là, nous joignons les gens qui peuvent jamais à l'hôpital une fois dans la vie. Ça fait matin, nous avons plusieurs cas, machine actuelle avec c'est Boniface.
St. Boniface Hospital is a unique hospital, and that's why I've been here for 19 years, because this hospital cares above all for life.
Even if they lost everything, they still want to fight to rebuild their life. And I think with small support, they can do extraordinary things.
As always, the commitment of our staff really stood out to me in that video. I saw firsthand how the team sacrificed so much to care for our patients through the civil unrest, the pandemic, and the earthquake.
It's pretty incredible thinking about all that they've done in the past year. Let me share some numbers. We've provided care for more than 3,000 earthquake survivors. We established an ortho program within 1 week after the earthquake. We have handled a 30% increase in deliveries and a 50% increase in NICU admissions in an already full hospital. Even before the earthquake, we'd conducted nearly 5,000 surgical procedures and 9,000 visits to the ER, the only 24/7 ER in southern Haiti. And our outpatient clinic has seen over 146,000 visits. And a key part of all of this is our partnership with world-renowned institutions and expert clinicians like Dr. George Dyer.
We are very lucky to have Dr. Dyer with us tonight. He is the director of the Harvard Combined Orthopedic Residency Program at Brigham and Women's Hospital and associate professor of orthopedic surgery at Harvard Medical School. Thank you, Dr. Dyer, for joining us.
Oh, thank you for having me.
What inspired you to come to Fondebla after the earthquake?
So for the last several years, I've helped to organize a conference in Haiti, actually. And this year, like the last couple of years, it's been virtual because of just problems in Haiti. And the second day of our virtual conference was Saturday, August 14th, the day of the earthquake, starting at 9 a.m., which was just 15 minutes after the earthquake. So when we dialed in and got our Haitian partners on, they were in sort of disarray and couldn't tell exactly why right away, but they came on to say there has just been an earthquake in the south of Haiti and we're all checking on our families and this kind of thing. And so that just, of course, we canceled the conference for that day, but that just changed the next 2 weeks for me. So it became a daily check-in with them. How could I be helpful? Helping to organize equipment and logistics that could be sent to Haiti. But within a few days, the people in the hospital asked if I could come myself to help with some of the orthopedic cases. I thought I might ask you if I could.
Yes.
What were those first couple of days like for you?
Actually, it was like a big, like chaos.
Yeah.
Actually, we were not expecting that to happen at that time. And we were already overwhelmed with work and receiving patients from everywhere, and that happened. And we knew also that major hospitals got destroyed, so we would have a lot of work to do.
Wow.
Yes. But when you got here, what did you see?
So the first thing I'd say, actually, and it might not be the answer you expect, is it was just wonderful to see how the hospital had grown. It was really wonderful just to see the place living and going. And then, of course, there was just the earthquake victims.
Right. So you've seen the hospital, actually the surgical ward at the beginning, and you saw the transformation. But what made the biggest impression on you when you got here?
I think it was really the expertise that was happening in the hospital, just how everything was in place, and thinking just about orthopedics. All the pieces are in place now to have an orthopedic program, except we just need to make it go. So the general surgical expertise, the anesthesiologists are so good. The emergency department is just amazing, especially the staff. The building is great. But the level of expertise is just unmatched, and so all of those pieces are there. I'm in touch every day now with the emergency department staff, and they are consulting remotely with me on cases that are still coming, orthopedic cases, which until there's an established program are not going to get routine care in St. Boniface, and it's clear that there's a need. There are 4 or 5 cases every single day that come through that need surgery or at least need orthopedic care that are not related to the earthquake. These are just things that have happened in the environment and which will not get care except if there's a permanent program.
Yeah. So from your answers, it's almost clear to me why it is so critical for St. Boniface Hospital to develop a permanent ortho program. But I'd like also for you to tell me what kind of potential you see in it.
I think that to serve the community of St. Boniface and really the region of southern Haiti. There are so many orthopedic problems, so many orthopedic cases that it's a must do now. When I just look at the number of patients who come through the emergency department now who have problems unrelated to the earthquake, which need care and which will not get care without permanent orthopedics, it seems to me like there's just no question. But also, St. Boniface is just the perfect place to do it. The hospital has all the potential, all of the resources to be the place. The physical infrastructure is set up in a way that's absolutely ready to expand and include orthopedics. It's got a robust general surgery program with sterilization, with excellent post-surgical nursing care in the surgical ward, and it's even got a spinal cord injury and rehab center attached, which is kind of amazing. In the middle of the woods in southern Haiti, there's exactly the place you need for a permanent orthopedic center of excellence.
Thank you. Thank you. So we want to keep this work going. We want to help as many people as possible to get them back to their normal lives. And so for this work, can we count on you?
Absolutely.
Thank you. Thank you.
For sure.
Thank you. And we also know that we need a lot of partnerships, and you will be helping us getting our hands on those critical partnerships to keep doing the work that we do here.
I think that's absolutely right. I think as for all the great emphasis on simple things and on local reliability, there's no way to do something which is as technical and as dependent on equipment as orthopedic surgery without a lot of outside help. And so I'm looking forward to helping you to organize and solicit donations and partnerships to keep it going. What I hope to build is this partnership through the Harvard Orthopedic Training Program where I work now, to continue an ongoing partnership and exchange. We'll see where it goes, but I think the sky's the limit.
Thank you so much, Dr. Dyer. Thank you for your vision, and thank you also for your partnership.
I really appreciate it. Thank you. It's an honor and a pleasure to get to help. I hope I can be useful in the future.
Thank you. You already are. Thank you.
When Dr. Dyer mentioned our trip to find patients, it brought back so many images of flattened buildings and the people who desperately needed care. It also reminded me of all the staff who have suffered from the trauma of responding to more major disasters than should be expected of anyone. They showed up every day, ready to help the people who needed them.
Yes. All of us fear that keeping St. Boniface open and fully operational is the best we can do to help heal and rebuild.
During the next video, we will meet two of the patients who were saved because of that dedication. Despite the unrest, COVID, and other challenges, our staff persevered. Benjulo is 18 and came to us from Port-au-Prince after being unable to find care in the capital. And Moniz was generous enough to allow us to accompany her as she welcomed her baby, Stephen, into the world.
Yo relève, yo dit gen football, faut me jouer parce que je connais jouer football. Pendant que je joue, je vais mener 2-1 sur l'équipe adverse là. Je vais dribbler un joueur et puis il frappe dans le pied. Et puis même joue ça et puis me sentir m'a fait mal. Je suis passé dans l'hôpital avant et puis je viens voir Jean-Pierre et puis je viens transférer même Saint Boniface parce que il y a une solution. L'homme d'Afrique vient à l'hôpital là, je suis peur, l'homme d'Afrique vient, mais après quelques jours, je m'appelle, je suis même toujours à souffrir, toujours à penser avec souffrance, je suis toujours dans mes peurs. Mais je suis là. Je fais 2 mois dans l'hôpital là.
Il était venu parce que il était une maladie qui est liée facile nécrosante. Côté il était fréré Kounia à cause qu'il était pas au prince, pas vraiment vrai gain l'hôpital à proximité de côté là. Et que qui ça mon la qualité fait, il était alors un médecin traditionnel ensemble avec elle. Par le fait que il était venu à temps et que nous pensons que il a toute chance pour le sortir.
Il devait mettre remède fait sous. On va pas dire mettre remède fait mais ça après te sorte ka docteur on te mettre remède là. Pour les côté à faire remède pour lui, c'est dans relève, c'est dans dim vinn là. Pour les moments. Pas qu'on a souffert, qu'on crier. Ça qu'on fait mal en pile, elle a souffert.
L'hôpital, ou capable de moyens économiques pour aller là-dedans. Ou venir là, mais ou je même soin avec eux. Et ça fait important pour moi un pile, il fait un pile bail pour moi et tout. Pour Kounia, m'a fait effort, mais j'aime presque bon. Mais si toutefois il est arrivé, il vient bon net. Ça qui arrive, je toujours jouer parce que moi j'aime le football. Mais si je ne suis pas capable, je vais forcer. Mais depuis que je marche normal, j'ai toujours souhaité, avant de être malade là, parce que j'ai espoir.
Oui, je suis inquiétée parce que j'ai des gros douleurs, ça fait mal en ville, moi je suis inquiétée, je connais des plus gros problèmes toujours. Si je suis là, je suis perdu de petit monde aussi, je suis autant pour moi, autant pour l'autre monde. Je vais pas payer pour médicaments et gratis. Je vais dans la mairie, je vais jouer avec lui, jouer. Je crier, aller me crier tout. Je me crier. Si je vais sortir de là, je vais là, je crier.
Now, it is our great pleasure to introduce Karen and Sarah, another longtime partner and friend of Health Equity St. Boniface. Karen has a special perspective on Father John's work in Boston, Haiti, and beyond. She has seen the impact he has had on HEI and has herself felt the comfort and inspiration of his pastoral care. Thank you, Karen, for sharing your words about Father John.
Father John, or just John, or just Unni, whatever you like to call him, you know you are referring to a one-in-a-million kind of guy. He preaches like a prophet, he hugs like an Italian, and he's there for you like a brother. For 18 years, John has been the venerable pastor of Boston's largest Roman Catholic parish, St. Cecilia's Church in the Back Bay, to which parishioners flock from far and wide. You may also find him slapping backs or praying with Boston firefighters for whom he has served as chaplain since a horrific Back Bay fire took the lives of several firefighters in 2014. His exemplary service throughout Boston has earned him the prestigious position of Bar Foundation Fellow, the only Roman Catholic priest to receive such an honor in the fellowship's 16-year history. Tonight, we want to focus on John Unni's love for the people of Haiti and his commitment to Health Equity International. In 1986, while teaching high school, John traveled to Haiti at the urging of a deacon, Charlie Sullivan, and his wife, Barbara. He volunteered with children, outcasts from their families and society, and dished out rice and beans from a hubcap. He was struck by how much they needed, in his words, food for the tummy and the soul. This seminal experience changed his life and compelled him to enter the priesthood. John has returned to Haiti many times to break bread with children and also to pray with and encourage patients at St. Boniface Hospital in Fond-de-Blanc. He has taken scores of parishioners and college students to Haiti, offering them the kind of transformative experiences many of us have had while traveling there. John wanted to be sure I told you about the deep respect he has for Father Jerry Osterman and Annette Caniff, the visionary, unsung heroes and founders of what is now Health Equity International. Without them as his role models, he would not have become one of HEI's strongest champions. John has a remarkable gift for leadership. He serves on 4 boards, including Health Equity International's. When I asked Connor Shapiro what makes John an indispensable board member, he said, John always pursues the values of equity and dignity and the inherent worth of every single person. He calls upon his deep empathy to understand issues from different angles, not just from the perspectives of staff and board, but from the perspectives of Haitian community leaders and residents. He listens carefully to those who don't have big megaphones. When I asked John what inspires him about serving on the HEI board, he said, I'm always asking myself, what in the world am I doing on this board with such really smart and generous people? The truth is, they inspire and energize me. I love to listen to their experiences and work together to advance the mission. While John is passionate about the social justice mission of health equity for all, he recognizes caritas, the love for humanity, as equally important. Whether John is at a hospital bedside or in a boardroom, he radiates that love. And it is instinctive that we love him in return. My friend, Father John, on behalf of the Health Equity International family, it is our great privilege to honor you tonight.
Hey, listen, we're on this life for a short time. I say this in my homilies all the time. Whether it's 3 years, 30 years, or 130, it ain't much more than that. So if you think of this concept of eternity, that 100 years, give or take, is a pinprick in light of that. And so I think about, like, whatever the time is that we've been given in the pinprick of this being on this planet, like, do something good. I went to Haiti probably, I don't know, when I was 22. So that was almost 40 years ago. I just couldn't believe what I saw and experienced. It was impressionable, and it really kind of pushed me over the edge with you know, moving forward in the way that I did. It opened up my heart, my mind, and my spirit. What propelled me first was need, and then and I was inspired by people who were just giving of themselves, all of themselves. When I think of, like, Jerry Osterman and Annette Caniff, like, when they began this whole thing, like, they were doing it because they had something going on in their hearts from a faith perspective that was like, you gotta take care of people. And so that really, like, moves me and it fires me up. You know, and now, of course, I end up in the back bay of Boston, and I should be probably in the streets of City Soleil or someplace, you know, but, you know, I wrestle with that too. I always see my role, like, as John Unni as the person, but my role as the priest, to be the conduit. I would say be a conduit of the Spirit, you know, and the Spirit is all about justice and equity. One of the letters from James says, you know, what good is faith without action? You can have the best masses going, the best liturgies, all that, but unless you're helping people, what good is that? God's not interested in that. For me, faith has to be connected with action. A few hundred miles off of our Floridian coast, the Haitian earthquake, Connor called from St. Boniface Hospital, this hospital that we support and are very involved with. The walls were standing, surgeons flew in, people came from all over, and they're taking so many folks in. St. Boniface Hospital, Health Equity International. It's right on the website. There's a donate button. That money goes directly to the hospital and to care. So much going on down there. No matter who you and I are, no matter how much we have, that doesn't matter. What matters is, do we use this stuff not just for our own benefit, but for the benefit of others? Do we try to make people's lives better? We're called to share. We're called to empower. How do we take care of each other? How does our view of mutuality, brothers and sisters, all of us, affect how we take care of each other? My father used to say, Johnny, you've never seen a U-Haul behind a hearse. In other words, you can't take it with you, right? So, like, it's a tool to be used, you know, and, you know, are we using our wealth? And wealth can be financial wealth. It could be the wealth of, like, experience and the wisdom that comes from that. It could be the wealth of, like, relationships and connection with other people. But how do we use all of this stuff to help other people? And, you know, I know there's Haiti fatigue. And yet, you know, I see St. Boniface HEI, and I'm like, here's a place that, like, does it well. St. Boniface is not just a hospital. Like, HEI isn't just an organization. Like, it's all about building relationships. You know, we are our brothers and sisters' keepers, so to speak. It's like real deal, boots on the ground, get it done type stuff. I'd say being affiliated with HEI and St. Boniface Hospital grounds me. It tethers me to be about what I'm about as a faith person, you know. I think we're called to take care of each other. And I think that's what this organization's about. You know, one of the last times I was down there a couple of years ago, we ended up going through the different wards in the maternity ward, and, you know, we're all gowned up, and I saw smiles on people's faces, you know, of, like, comfort and gratitude. And it's such an overused word to say that the place is awesome, but it really does evoke awe when you see all the levels and possibilities of connecting and healing and accompanying and encouraging. And that's really life-giving stuff. If we don't have hope, what do we have? Why do people go on? That hope propels us to the next steps. I can't thank enough folks who've given and who've made it a priority in their lives to support HEI and St. Boniface Hospital, because without it, none of this stuff would be happening. I think St. Boniface, HEI, all the work, all that you see going on there provides this great container for all that giving to continue. So I would just say thank you and keep giving, because it's doing the right thing. I'm humbled beyond belief for this honoring, but the real honor is to be affiliated with HEI.
So let me guess. This is the part of the evening when we ask people to continue to help us serve the people of Southern Haiti?
Yes, it is. Now it's time for Fund a Need. We wish we could do this in person, but the good news is that this year we have an anonymous donor who has agreed to match up to $250,000 in donations tonight.
So, whether you can give $5 or $50,000 tonight, your impact will be doubled. I hope you'll consider making a gift right now.
We hope that you will click the link in the chat or visit our website and make a gift tonight to stand alongside the people of Haiti during this difficult time. Any gift you make tonight will help us grow, strengthen, and shape our work, including our ongoing earthquake relief efforts. As Dr. Dyer pointed out, orthopedic surgeries require highly specialized tools and equipment and months of recovery.
Jubens, a 9-year-old boy, is one example of someone who has benefited from the program. During the earthquake, his home collapsed on top of him and broke both of his legs. We brought Jubens back to St. Boniface Hospital, where he received surgery he needed to begin healing his legs. Without that surgery, Jubens would have lost use of his legs entirely.
A gift of $50,000, matched by our donor, will help us procure the equipment and supplies we need to expand our orthopedic surgery program so we can help more patients like Jubens.
A gift of $50,000 can do so many other things at St. Boniface Hospital too.
We have countless other examples of how we can put your donations to work. Jean-Yvon contracted COVID-19 earlier this year. He went to 5 different hospitals and clinics in southern Haiti looking for the oxygen he needed to stay alive, but no one could help him. Only St. Boniface Hospital was able to provide him with life-saving oxygen therapy and safe, dignified care.
A gift of $25,000 tonight can help to fund 10 portable oxygen concentrators. These critical devices help Jean-Yvon and so many of our COVID patients to breathe and regain their strength as their bodies fought off the deadly virus.
It can also fund a mobile clinic, providing care for those most affected by the earthquake for 1 month.
Even before the earthquake, St. Boniface Hospital was the main maternal health center for the entire region. Women like Dislon have always depended on us for obstetric care. She had a complicated pregnancy and we delivered baby Kenny, her first child, by an emergency C-section. Kenny spent several weeks in our NICU, growing healthy and strong before he returned home.
A gift of $10,000 can help us safely deliver 40 babies for patients just like Dislon and Kenny. $10,000 also provides 4 months of inpatient care and rehabilitative services for an earthquake survivor.
As we said earlier, we have seen a huge surge of patients at St. Boniface Hospital since the earthquake in nearly every department. More patients than ever before are depending on us for the care they need.
Expanding our hospital's capacity to care for more patients is critical. A gift of $5,000 can help us purchase 20 new hospital beds, which are greatly needed in our emergency, surgical, and maternity departments.
When patients like little 2-year-old Ritna arrive at St. Boniface Hospital in the need of urgent care, we must have space to take them in. A wall of Ritna's house fell on her leg, causing a massive wound and severe infection. With more beds, we can care for more patients like Ritna and ensure that they receive world-class treatment from their illness and injuries.
$5,000 also funds essential medications for our pediatric unit. Your gift of $5,000, matched by our generous donor, can make a huge impact on our capacity at St. Boniface Hospital, and it can help us in so many other ways.
Training is also a critical part of how we strengthen the overall health system in Haiti. I remember Rose, one of our nursing interns. During her time with us, she worked in each department, caring for patients with every kind of illness or injury. When nursing students like Rose leave St. Boniface, they bring everything they've learned to another facility in Haiti and share what they've learned. They are truly the future of our country.
A gift of $1,000 supports training for clinicians like Rose at St. Boniface Hospital, As we take on the burden of care for the region in the wake of the earthquake, we must continue to raise the already high bar we've set for ourselves to ensure that we are always delivering the best possible care. A gift of $1,000, matched by our generous donor, can do so much at St. Boniface Hospital. Please give today. There are so many ways your support of any amount can have an impact on our work and help us save more lives.
Our gala booklet contains stories from the hospital and ways in which your support can make a difference in the lives of our staff and patients. If you haven't received it, you can find it online. I hope tonight and in the coming days, you read through this booklet and continue to support this important, life-saving work.
We hope that you will click the link in the chat or visit our website and make a gift tonight to stand alongside the people of Haiti during this difficult time.
Merci l'hôpital, merci docteur, merci monsieur, tout ça fait pour que me soutien mon là, bah quand on merci de casser pour camper après bon Dieu c'est monsieur aussi docteur.
Alors, staff là dit nous merci en pile. Nous-mêmes qui dépensons avec le peuple là qui est dans le besoin.
Grâce avec support, nous en pile monde joindre soin et soin joindre soin adéquat.
Et yo aider tout le monde dans tout département, dans tout 10 départements. Yo aider tout le monde ça yo. Et c'est ce que la journée pour les monde qui connaît là.
Nous connaissons tout ce qu'on fait pour nous supporter.
C'est des cas nous pas joindre si nous-mêmes tout nous pas aider ces Boniface pour résoudre le problème ça.
We have St. Boniface Hospital who give care to anybody.
Bon, merci pour le support que vous avez, St. Boniface. Et ça aide nous en pile pour nous capables de continuer à prendre soin.
I would like to say thank you to all of our supporters who permit us to have supplies, meds, and the ways to go very deeply with our response to go to rural area where people didn't have access and to permit us to save life.
It has been an incredibly challenging year for so many of you, and you have stepped up to support us in our time of need. Thank you so much.
We appreciate you taking the time to join us tonight. Thank you.
You can find out more about our work and make a donation at our website, HaitiHealth.org. Thank you, stay safe and healthy. Good night.